One of the exciting legacies of the West African program is the improved approaches to measles. And another operations officer, Jean Roy, who works with the League of Red Cross Societies, will now share some of the excitement that is currently going on in that area. That's it.
Thank you very much for giving me this opportunity to talk about some really great, exciting news that's happening in Africa. There is very good news indeed. And this is one of the great legacies, again, as polio eradication. So is freeing Africa of measles. We're not using the word elimination. We're not using the word eradication. We are very happy to do what needs to be done and show some impact, which I hope I'll be able to demonstrate. But first of all, I learned everything I know about public health and measles from Stan Foster. And I owe him my career, my life. He was the mentor from day one at Emory in 1966, rooming in the dormitory at Emory, and then my moving to Marmots with others, a rooming house right across the street, which no longer exists. But Stan was always there, and then before retiring from CDC after 32 years, I served as Stan's deputy for at least 6 years. And the message there was measles kills in Africa, and we need to do something about it. So let's move on, and thank you again, Stan, and all of you. And there's somebody in Geneva, British friends of ours, and we share stories. We're all in our 65 plus, sharing life stories, and they chose the public path of a private business, and I took and they keep telling me, Gene, you ought to count your blessings, and you have so many. And I agree, and I thank the Fagis and the Hendersons and the Censors and all of you, because my life has been really blessed to walk in your footsteps, even though you have holes in your souls. So let me tell you a little bit about measles disease very quickly. We've covered a lot about that. A little bit of the historical perspective is how this has evolved, because I am talking about the Africa Measles Initiative, a few words on that. Talk about some achievements, the impact we've been able to achieve, and the future. This is not short-term. I think the partners are committed to long-term. We have now scheduled campaigns until 2015, and we are committed, and donors are committed. And then the surprise of it all, from smallpox to expanded program to measles, to polio, to measles, and now to malaria. And you'll say, what's malaria got to do with measles? You've heard it all before. Measles is a killer in Africa. And according to WHO, the African Regional Office in 2000, 56% of the deaths were due to measles back then. Let's not forget malaria. 3,000 children are dying every day under 5. That is how many jumbo jets crashing every day from malaria. But measles has been the biggest killer traditionally. Stan used to say all the time that many people in Africa, in certain communities in Africa, would never name their child, their newborn, until the first epidemic cycle had occurred after that birth. And if that child survived the epidemic of measles, then we gave them a Christian name, baptized, and whatever. So major problem. A lot of people in UEIS offices, oh, measles in America, it was not that bad. In Africa and in developing countries, deadly disease. Globally, in 2000, there were approximately 2 million vaccine preventable deaths, but half of these were measles, attributed to about 777,000 deaths. In 2003, globally, worldwide, we're talking about 23 million children under 5 who suffered from measles, and 480,000 children worldwide died. Note the difference. That's what we're going to talk about. In Africa, an estimated 38 million children under 5 are at risk from measles, so we have to vaccinate them every year, don't we? 1 in 100 children who becomes infected dies of measles, or was dying of measles. Measles is one of the most contagious diseases, you heard that, in virtually every country. Risk and complications, well, these children who are malnourished, as you've heard before, vitamin A deficiency, have multiple infections, have anemia because of intestinal worms, because of malaria, are at very, 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 very high risk of mortality. Then when there are complications, such as pneumonia, blindness, and so on, simple hygiene, as Stan used to say, simply washing the eyes would prevent blindness. Very, very simple things could be done once you had measles. A little bit of the historical perspective. You heard that 1963 was when the first measles vaccine was licensed in the US. I was a Peace Corps volunteer in the Cameroons, and even though I was not in health in 1963, I was 63, 65 in West Cameroon, I had heard that in Upper Volta they were using this new silver bullet, and it was called measles vaccine. And I had no idea what public health was. This was before my CDC. I always thought CDC was the Cameroon Development Corporation because they ran all the plantations in Cameroon. But this marked me. I remembered that. In '66, 3 years later, that silver bullet came to haunt the smallpox program because, as USAID said, we want measles, not smallpox. And the African government says, we want measles. We have it in all the countries and all the communities, but we don't have smallpox everywhere. 1969, after the measles smallpox program, again, due to the work of Fagey, Mike Lane, and others, the Gambia was the first measles-free country on planet Earth. In the 70s, measles controlled all the smallpox warriors. Many of them came back, if they didn't go to Bangladesh, came back to the United States, as I did, and worked for Alan Hinman in upstate New York. And what did we do? Surveillance, investigation, closure of schools, containment for measles. And hence started the intense measles control in the United States in the 70s. In 76 and 77, you heard before, Rafe off to WHO to expand, for the expanded program on immunization. And they ask me this all the time in Geneva, what's the expanded program on immunization? I said, it's expanded from the measles smallpox. And that's what it is. They just simply expanded, used the logistics and management systems that had been built up over the smallpox measles with the investments, and Rafe built on that and convinced the world and the globe that we should do routine immunization routinely. In 1980s, measles control in the Americas, polio eradication and measles, and again, a smallpox warrior, Ciro de Quadros, who led this whole effort. He was a smallpox worker in Ethiopia, came back. But measles in Africa, look at that, 2001. And it really is 30 years because we ended our measles smallpox program in 1971, 72. And everybody forgot about measles in Africa, even though USAID was committed, but there was no longevity in donors. And so I'll tell you the story about the 2001 and 2005 measles in Southeast Asia. How did the Africa Measles Initiative? Well, in 1995, in my last few years here at CDC, we got a request from the International Federation of Red Cross and Red Crescent Societies. And they were panicking because diphtheria in the former Soviet Union republics was spreading like wildfire, and they thought that Western Europe would be invaded and have massive diphtheria epidemics. And so WHO, UNICEF, and the International Federation raised $32 million to vaccinate everyone in the former Soviet Union. And the Federation of Red Cross says, my God, we do disasters, earthquakes, volcanoes, floods, famines, but we've never done a mass vaccination campaign. Somebody at WHO said, call CDC. And I happened to get the call. I knew I was going to retire. I was looking for my future. What do I do after I retire? I've never worked in Europe, Geneva, London, Paris. I've always 35 years in Africa. So it's time for me to go. So I accepted the challenge to go help the Federation as a CDC, a consultant, and for 3 years worked on massively vaccinating everyone in the Ukraine, Belarus, Latvia, Estonia, and Lithuania. I came back to CDC and said, I've discovered the Rotary of Measles. Here was a global organization for advocacy, for fundraising, and volunteers and organizations in every country, better than the Rotary. So I told Peter Strebel, Steve Kochi, Melinda Wharton, I said, I have discovered the Rotary of Measles for Africa. And they said, sure, sure, sure. So I retired in '98 and convinced the American Red Cross that they should address public health problems, not just disasters. And sure enough, they assigned me to Geneva, where I've been ever since. And in the year 2000, we published the annual disaster report was on public health for the first time. It had always been on earthquakes, volcanoes, and so on. And that year, we looked at 1999. In 1999, there were 120,000 deaths from natural disasters. There wasn't a tsunami in Pakistan, but that year was pretty disaster-free. But 13 million preventable deaths had occurred. And we asked, where's the problem? It wasn't and or, it was and. Do both. And that was the beginning of the International Federation. The first CDCer was assigned, that was Brad Hirsch, who had polio and measles experience in the Americas. Perfect. Then the first measles appeal, they'd never appealed for funds for measles, polio, HIV, and TB. And that started. And then we launched the ARCHI, which is the Africa Red Cross Health Initiative, a 10-year effort to mobilize the 2 million Red Cross volunteers in Africa to do the home-based kind of things, that polio and so on. In 2001, we assigned a CDC epidemiologist to the American Red Cross because they said, yeah, this measles thing is good, but we're not a health agency. We need help. I said, no problem. And CDC assigned Mark Grabowski to the American Red Cross, and he is the D.A. Henderson of measles for Africa. I might have had the idea, but he made it work. So I switched it around. I made a doctor an operations officer, and I played the role of the epidemiologist, or the brain power. And that's the beginning of the Africa Measles Initiative. At the same time, we had gone to Ted Turner to talk about ARCHI, the UN Foundation, and we were saying we should work together. I had no idea that this was going to turn out that they would support measles. And what happened is the CDC had $5 million a year for measles from Congress. The American Red Cross has been raising $5 million. Ted Turner says, I'll match that, so $10 million. So we've raised $20 million a year for the supplemental immunization activities in Africa, which are, as you all know, we need to do these supplemental if we really want to control and eliminate diseases for various reasons you'll find out. These are the partners. It is a virtual partnership. If we close down this partnership today, no one loses a job. But what Mark Grabowski has done, and under the leadership of and the convening power of the American Red Cross, is to bring all these people together. Gavi, who just gave $27 million, the Canadian Red Cross, Canadian International Development have been fantastic. The Mormons have been fantastic. ExxonMobil. So we have over 40 partners. We are now into our 305th weekly global conference call, totally virtual. It's only on Wednesday afternoons, a measles call all over the world. What has happened to date? We have had, we've given 213 million vaccinations since 2001. We've had 49 national campaigns. First, all the children under 15, then all the children under 5. And this continues. So we've given over, that's the breakdown by year of 213. We've raised $144 million so far, and more are coming. We've saved more than 1.2 million lives. Again, we've noted a 60% reduction in measles deaths in Africa, and the coverage rate for the continent is very closely reaching over 90–95%. I should point out what you can see here. The WHO in March reported, let's see if I have a little pointer. I have to find it. Well, anyway, you see in March the circled date up there. 40% reduction globally, but that was 39% outside of Africa and 46% in Africa. Just a few months later, in November, they reported 60% decrease in mortality in Africa. And in 19 selected countries, we have a 91% drop in measles. They are closing pediatric wards throughout Africa because there's no measles. This, you might think, is the old smallpox days. Remember all those long lines and mothers and children coming to be vaccinated? This is actually in December 2004. We did integrated measles campaign. We did a measles campaign, but just prior to Togo, we said, my gosh, we've set up the logistics, the management to do these. In Kenya, we vaccinated 14 million children in 7 days with 40,000 workers. This was in 2002. So these 49 campaigns, it's automatic now. It's all about systems and management and communication and transparency. And so I had done an evaluation in Togo, and I wanted 25,000 bednets. I says, we have such a good community structure that all we have to do is just bring the bednets in, and they'll be hung, and people will be taught. The Canadians responded and said, would you like 1 million nets? And they gave us $7 million so that we could add nets to the 1-week integrated measles campaign. Every child got vitamin A supplementation and deworming, bemendazole, all in 1 week. And now every house in Togo that has children under 5 has a bednet, an insecticide-treated, long-lasting bednet. We've gone on to do Niger this year with 2.3 million bednets. So 1 week during polio rates went way up, and now every house in Niger, a country twice the size of Texas, all done in Niger with 1 week in December and a week in March. This is what USAID and other governments have been trying to do for 40 years. The Red Cross can do it in a week. And that's a lesson learned. It's all about logistics management. We planned for 9 months, but get it done. That 1 week was $15 million in Niger. So where are we going? We're planning another 150 million vaccinations in the next 5 years. And as I say, we have the schedule for the next 5 years, but we're aiming to go through 2010. Right now, we're finishing up Kenya. This year, we're doing 6 million vaccines. We split it, 3 million, and they are also distributing bednets. We did Mozambique with bednets during the measles campaign, and we're doing all of Sierra Leone in October, November, and over 1 million. The lesson learned is these are the people that are the beneficiaries and who make the program work. This fellow, Antone, is from Zambia. And 2 weeks before the Zambia measles campaign, and we gave out 100,000 nets as a pilot in Gambia at that time, he went around and registered the children in villages, as we had thousands of volunteers doing that. And they found that the mothers were sick or had to work or had died from HIV, and grandmothers couldn't come bring the children. And so what he did the day of vaccination, went all around with his bicycle, picked up the children. You can see their dusty feet except for one who was standing by enjoying the picture. He lives right down the ditch here. But the others, he would walk miles and miles, get them vaccinated and bring them back. And then he'd bring another group back and forth. So Antone is the real hero, and we have 2 million of them in Africa. And they are the ones that are making their children and their neighbors healthier. Thank you very much.